has been a big obstacle for a lot of families as far as being able to speak to the doctors and to exchange information and history of our loved ones, because who would know our loved ones better than ourselves? And this has not been done because the doctors have been able to get away with not including the mothers and fathers. Once their son or daughter turns 18, they legally don't have to say anything to them, especially if the patient themselves thinks that mom and dad are from ISIS. They are told by the patient not to share any information, so that cuts the families completely out of the picture, which can be devastating to these individuals, as you know. So just to come off real quick with the HIPAA topic, I'm going to go ahead and read this little bit of insert to you. It's going to be clarifying the HIPAA quagmire, they call it. It requires the Secretary of Health and Human Services to issue guidance. And I have websites as well if you're very specifically interested in these types of topics of the law. It's going to clarify the circumstance under which healthcare providers and families can share and provide protected information about a loved one with serious mental illness. And it requires the Secretary to develop model programs and trainings for healthcare providers to clarify when information can be shared, and trainings for patients and their families to understand their rights to protect and obtain treatment information. That was already in place. This HIPAA law and instruction was already in place, but what happened was that it became distorted. The information became unclear on what was being able to be shared with the family members. So in turn of that, in result of that, there was no information being shared. So it was one of those things where it was in place, but it just didn't work for us. But they talk about the Assistant Secretary of Mental Health now. It's going to be a position appointed by the President. And this individual will be responsible to oversee the whole operation of our mental health system in our country. We've never had that before, which is a gold to us, because now we have somebody in office in DC that we can call and ask for certain types of things like investigations, or to have some kind of resource that we've never had before at a national level, which is huge. And a lot of these organizations that have been in place and have been using the funding that's available to them for mental health reform, now they have accountability factor in their operation, which had been slacking for the past 25, 30 years. So we've seen a lot of this money not go to the right places. It definitely doesn't come to our types of children that don't understand that they have a mental illness, and they have the right to refuse treatment because they have what the doctors call anosognosia, which is a lack of insight of their illness. So right now that's in place, but that will certainly be something that they're going to be dealing with in a lot of different ways. We're going to talk about Laura's Law, Assisted Outpatient Treatment Law, and how that law is coming into play locally. And on the East Coast, it's called Kendra's Law, which is also Assisted Outpatient Treatment Law. Gail?
Yeah, I just want to say something.